As the U.S. and Europe scramble to secure vaccines even before they're fully tested and ready, concerns are growing tonight about a coming free-for-all, with rich countries gobbling up supply. And virologists warn unilateral approaches won't work, that unless the world is immunized, the virus will keep coming back.
If the goal is to really end the pandemic, you have to take a global view.
Seth Berkley is the CEO of a group called Gavi, the Global Alliance for Vaccines, responsible for vaccinating 60% of the world's children. Gavi's ambitious plan, in coordination with the World Health Organization, is to secure deals with drug companies for 2 billion doses of a variety of vaccines and distribute them more equitably around the world, concentrating first where infection spreads the most, among doctors and nurses. Gavi hopes immunizing a targeted 20% of the entire planet will break the pandemic's back.
Even if a country has access to vaccines, if it wants to go back to normal, if it wants to have trade, if it wants to have tourism, if it wants to have an ability to move around, it can't have large reservoirs of virus in other countries.
More than 160 nations have signed on to Gavi's global vaccine initiative, with one notable absence: the United States, though talks are ongoing.
How troubling is it to you that President Trump and his administration aren't buying into this?
Let's see how that goes. My suspicion is that the U.S. at the end will pay attention to the global issues, because I think at the end that will prevail.
Gavi says its goal is to push out 2 billion vaccine doses by the end of 2021.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here, and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.